Defining the compulsion. Distinguishing habit from disorder, compulsive buying disorder, historically termed oniomania by the German psychiatrist Emil Kraepelin in the early 20th century, is fundamentally an impulse control disorder. The behaviour is marked by recurrent, intense urges to buy that are experienced as intrusive and difficult to resist. Crucially, the motivation for buying is typically the process of acquiring the item and the emotional surge it provides, rather than the utility of the item itself. Items often remain unused, still in their packaging, suggesting the thrill is momentary and rooted in the act, not the possession. The distinction between a casual shopaholic, a term often used lightly, and a person suffering from CBD, is the degree of distress, loss of control, and functional impairment. For a diagnosis to be considered, the purchasing behaviour must be excessive, persistent over time, and cause significant distress or impairment in social, occupational, or other important areas of functioning, such as accumulating overwhelming debt, hiding purchases from loved ones, or experiencing severe guilt and shame after a buying episode. While CBD is widely recognised in clinical practice, its classification remains contentious. It is not listed as a distinct disorder in the current American Psychiatric Association's Diagnostic and Statistical Manual of Mental Disorders, DSM-5, though its characteristics align closely with criteria for other impulse control disorders and, more recently, non-substance-related addictive disorders, akin to gambling disorder. This ambiguous status often contributes to underdiagnosis and lack of standardized treatment protocols, leading many sufferers to believe their behavior is merely a personal failing rather than a diagnosable condition.